I don't know if this is true, but God, would it be fucking funny. Today I went to the Eli Lilly versus Mochi hearing in San Francisco, and here's some takeaways that I had. First of all, it did not go well for Eli Lilly. And the reason why this case is important is because it might set precedent for hundreds of other cases against health companies, which is effectively Big Pharma trying to shut down compounding. I'm Sabina. I made a tool called GLP-1r. We help people compare providers, and we care a lot about access. I do content on accessibility. First, the judge was not convinced that Reddit was good evidence. She literally asked, did you talk to the individual patients and Redditors? And she felt like there was a general lack of evidence for a lot of Eli Lilly's claims. She also spoke about the distinction between customized medication and a customized treatment. So customized medication might mean the actual compound medication that people are taking, and then customized treatments might be the broad treatment from a doctor. So that might include conversation with the dietitian, counseling you, talking to you about your side effects, giving you general advice on obesity or losing weight. All of those things and conversations are sometimes also combined with medication itself. But the combination of those things is the practice of medicine and is the actual treatment. And there's a difference between the treatment being customized and the actual medication being customized. Those are two different claims. The judge also knew that a lot of people aren't compounded medication because they can't afford the name brand or their insurance doesn't cover it. And she did stress the price of the medication several times as being a motivator. And just because a patient doesn't buy Eli Lilly medication and buys compounding instead, doesn't mean that they can afford Eli Lilly's medication. 7 out of 8 people can't afford $500 per month. 60% of people in the United States cannot afford an emergency $400 expense. And that's not even taking into account many households have multiple people who might need this medication. Finally, the judge felt that Eli Lilly had no basis for allegations that compounding was a subpar product. They need to present evidence that compounding was not safe, and they need to present evidence that compounding was not effective. Lilly argued that compounding was less effective, and thus it would harm Lilly by harming their reputation and making people trust tirzepatide less. But the judge wasn't buying it. The judge was like, where's this evidence that's not effective? And if you follow my channel, about a month ago, the FDA released adverse events for compounded medication. They straight up said adverse events for compounded medication is not significantly different from FDA-approved medications. If you want more news on the case, go to my other video.